Hi everyone, welcome back to the channel. If you're new here, I really appreciate you joining us today. What I'm about to share could change how you think about your health, especially if you're concerned about bleeding problems, weak bones, or heart disease. There's a nutrient that millions of people unknowingly lack, yet it controls one of the most critical processes in your body. Without it, a simple cut could turn life-threatening. Without it, your bones slowly weaken until they fracture from minor falls. Without it, calcium builds up inside your arteries, hardening them like concrete pipes. This nutrient prevents over 15,000 emergency room visits annually from uncontrolled bleeding. Studies show people with low levels face 60% higher fracture risk after age 50. Your body needs this vitamin every single day for blood to clot properly, yet most people consume less than half the recommended amount. Right now, you might be taking medications that silently drain this vitamin from your system. You might be experiencing unexplained bruising, slower wound healing, or bone pain, never connecting these symptoms to this deficiency. The vitamin I'm talking about is vitamin K. Most people have heard of vitamin C or vitamin D, but vitamin K remains largely unknown, despite being absolutely essential for survival. This vitamin determines whether you bleed to death from a minor injury or whether your blood clots normally within seconds. It determines whether calcium strengthens your bones or dangerously accumulates in your arteries, setting you up for heart attack or stroke. Today we're covering everything you need to know about vitamin K. The critical benefits it provides your body, the precise amounts you need daily, diseases it prevents and treats, serious risks of deficiency, problems from taking too much, and crucial interactions with common medications. This information comes from extensive medical research and clinical data. By the end, you'll understand exactly how to optimize your vitamin K status for better health. Let me start with how vitamin K works. When you cut yourself, your blood needs to clot quickly to stop bleeding. This clotting process requires specific proteins produced in your liver. Vitamin K acts as an essential cofactor that activates these proteins. Without sufficient vitamin K, your liver cannot produce functioning clotting factors, specifically factors 2, 7, 9, and 10. Your blood takes much longer to clot, potentially leading to dangerous bleeding. Think of vitamin K like a key that unlocks these clotting proteins. The proteins exist in your liver, but they remain inactive, unable to do their job. Vitamin K comes along and activates them through a process called carboxylation. Once activated, these proteins travel through your bloodstream, ready to form clots whenever bleeding occurs. This process happens continuously in your body, which means you need a steady supply of vitamin K. There are two main natural forms of vitamin K. Vitamin K1, called phylloquinone, comes from plant foods, especially dark leafy greens like spinach, kale, broccoli, and Brussels sprouts. This is the primary dietary form, making up about 90% of vitamin K in typical diets. Vitamin K2, called menaquinone, comes from animal products like meat, cheese, and eggs, plus fermented foods. Bacteria in your intestines also produce small amounts of vitamin K2, though not enough to meet your complete daily needs. Your body handles these two forms differently. Vitamin K1 gets absorbed in your small intestine, though absorption rates are relatively low, around 10 to 20% from food. Fat in your meal significantly improves absorption since vitamin K is fat-soluble. Vitamin K2 stays in your bloodstream longer and may have some unique benefits for bone and heart health that researchers are still investigating. Both forms activate clotting factors, but vitamin K2 appears more efficient at activating proteins outside the liver. Now let's talk about daily requirements. Adult men need 120 micrograms daily. Adult women need 90 micrograms daily. Pregnancy and breastfeeding don't increase these requirements. Children need less, ranging from 30 to 75 micrograms depending on age. Newborn infants receive vitamin K injections at birth because they're born with almost zero stores, and breast milk contains very little vitamin K. Without this injection, newborns face serious risk of bleeding in the brain, which can cause death or permanent brain damage. These are adequate intake levels, meaning amounts considered sufficient for health based on observational data. No official recommended dietary allowance exists for vitamin K because researchers lack enough data to set precise requirements. Some experts believe these adequate intake levels might actually be too low, especially for bone and heart health. Research suggests higher intakes, around 200 to 300 micrograms daily, might provide additional benefits for preventing fractures and arterial calcification. Meeting your vitamin K needs through diet is straightforward if you eat vegetables regularly. 1 cup of cooked kale provides over 1,000 micrograms, more than 10 times the daily adequate intake for men. 1 cup of cooked spinach provides about 900 micrograms. Half cup of cooked broccoli provides about 110 micrograms. 1 cup of raw romaine lettuce provides about 60 micrograms. Vegetable oils like soybean oil, canola oil, and olive oil also contain vitamin K1. 1 tablespoon of soybean oil provides about 25 micrograms. For vitamin K2, natto, a Japanese fermented soybean food, contains extremely high amounts, about 1,000 micrograms per serving. Hard cheeses provide about 75 micrograms per ounce. Egg yolks contain about 30 micrograms per yolk. Chicken breast provides about 5 micrograms per serving. Beef liver contains moderate amounts. Most people get adequate vitamin K2 from their normal diet without specifically seeking it out, though fermented foods can significantly boost intake. Now here's the critical part about health benefits. Vitamin K prevents excessive bleeding, the most immediate life-saving function. Without adequate vitamin K, even minor cuts or dental procedures can cause dangerous blood loss. People severely deficient in vitamin K may experience bleeding inside the body, including bleeding into joints, digestive system, or brain. This happens because their blood cannot form clots properly. Vitamin K supports bone health by activating osteocalcin, a protein that binds calcium into bone tissue. Without sufficient vitamin K, osteocalcin remains inactive, and calcium cannot properly integrate into bones. Research shows people consuming higher amounts of vitamin K have stronger bones and lower hip fracture rates. Studies involving thousands of participants found those eating more vitamin K-rich vegetables experienced up to 60% fewer hip fractures. Supplementation studies show mixed results, with some finding reduced fractures and others finding no effect, suggesting dietary vitamin K from whole foods may work better than isolated supplements. Vitamin K protects your cardiovascular system by preventing arterial calcification. As you age, calcium can deposit in your artery walls, making them stiff and narrow. This calcification significantly increases heart attack and stroke risk. Vitamin K activates matrix Glay protein, the most potent natural inhibitor of arterial calcification in your body. This protein prevents calcium from depositing where it doesn't belong. Studies demonstrate people with higher vitamin K intake have less arterial calcification and lower rates of heart disease requiring hospitalization. Research shows vitamin K may help maintain cognitive function in older adults. Studies found elderly people with the highest blood levels of vitamin K1 demonstrated the best verbal memory performance. The mechanisms aren't completely understood but may relate to vitamin K's anti-inflammatory effects in brain tissue. More research is needed to confirm these cognitive benefits. Some studies suggest vitamin K might help with morning sickness during pregnancy, though evidence remains limited. Vitamin K may play roles in insulin sensitivity and glucose metabolism, potentially affecting diabetes risk, but again, more research is needed to establish these effects clearly. Now let's discuss diseases vitamin K can help prevent. Osteoporosis, characterized by porous, fragile bones, affects over 10 million Americans, 80% of them women. Adequate vitamin K intake throughout life, especially combined with sufficient calcium and vitamin D, helps maintain bone density and reduces fracture risk. Multiple studies show people eating more vitamin K-rich foods have stronger bones well into old age. Coronary heart disease, where arteries supplying blood to your heart become narrow and stiff, kills hundreds of thousands annually. Higher vitamin K intake correlates with reduced arterial calcification, a major heart disease risk factor. Clinical trials testing vitamin K supplementation show it can slow the progression of arterial calcification in people who already have some calcium buildup in their arteries. Vitamin K deficiency bleeding in newborns, once common and often fatal, is now prevented through standard vitamin K injections given at birth. Without this injection, up to 1 in 10,000 newborns would experience serious bleeding, often into the brain. Some research suggests vitamin K might help prevent certain cancers, particularly liver cancer and prostate cancer. Studies show vitamin K2 can induce cancer cell death in laboratory experiments. Clinical research found vitamin K2 supplementation reduced liver cancer recurrence rates in patients treated for hepatocellular carcinoma. However, other studies show conflicting results, and much more research is needed before recommending vitamin K specifically for cancer prevention. This remains an active area of scientific investigation. Talk to your doctor before using vitamin K supplements for any disease prevention or treatment. Your healthcare provider knows your complete medical history and can guide you appropriately. Now for deficiency symptoms. Vitamin K deficiency is rare in healthy adults because bacteria in your intestines produce some vitamin K, and most diets provide adequate amounts. However, certain people face higher risk. Newborns have very low vitamin K stores at birth. People with conditions affecting nutrient absorption, like Crohn's disease, celiac disease, ulcerative colitis, or short bowel syndrome, may become deficient. People who've had bariatric weight loss surgery sometimes develop deficiency. Long-term antibiotic use can destroy intestinal bacteria that produce vitamin K, potentially leading to deficiency after several weeks. Deficiency symptoms include easy bruising from minor bumps, small red or purple spots under your skin from bleeding, bleeding gums when brushing teeth, heavy menstrual periods in women, blood in urine or stool, prolonged bleeding from cuts that should stop quickly, nosebleeds that happen frequently or last long. In severe cases, internal bleeding can occur, which is life-threatening. Blood tests measuring prothrombin time show how long your blood takes to clot. Elevated prothrombin time indicates potential vitamin K deficiency. If you notice these symptoms, contact your doctor. Don't assume you have vitamin K deficiency without proper medical evaluation, as many other conditions cause similar symptoms. Now let's discuss toxicity and excess. Here's good news. Natural forms of vitamin K, both K1 and K2 from foods and supplements, have no known toxicity even at high doses. No tolerable upper intake level has been established because researchers haven't identified any adverse effects from consuming large amounts. Your body efficiently regulates vitamin K levels through liver storage and excretion. Excess gets stored or eliminated rather than causing harm. Studies tested people taking 10 milligrams daily of vitamin K1 for 1 month, finding no adverse effects. Other research used 45 milligrams daily of vitamin K2 for 2 years, again with no problems. These doses are hundreds of times higher than recommended adequate intake levels. Despite this apparent safety, you should not take massive doses of vitamin K without medical supervision. The synthetic form called vitamin K3 or monadione is toxic and no longer used in humans. This synthetic version can cause red blood cell breakdown, liver damage, and jaundice in infants. For this reason, vitamin K3 has been banned from over-the-counter sale in the United States. While natural vitamin K doesn't cause toxicity, some people may experience upset stomach or diarrhea from supplements. Allergic reactions are possible, though rare. Intravenous vitamin K1 injections have been associated with severe reactions, including bronchospasm and cardiac arrest, in about 3 per 10,000 treatments, usually when certain solubilizing agents were used. The main concern with vitamin K isn't toxicity, but drug interactions, particularly with blood thinners. This is absolutely critical information. Warfarin, sold as Coumadin, is a commonly prescribed anticoagulant medication that prevents dangerous blood clots. Millions of people take warfarin for conditions like atrial fibrillation, artificial heart valves, or history of blood clots. Warfarin works by blocking vitamin K's action in your liver, preventing production of clotting factors. This keeps blood thin and less likely to clot. When you take warfarin, consuming large amounts of vitamin K can overwhelm the drug's effect, allowing your blood to clot normally. This creates serious risk because clots could form and cause stroke or heart attack. Conversely, Suddenly decreasing vitamin K intake makes warfarin work too well, increasing bleeding risk. For this reason, doctors tell patients on warfarin to maintain consistent vitamin K intake day to day. Don't avoid vitamin K foods entirely, but eat similar amounts daily. 1 cup of greens one day and none for a week creates dangerous fluctuations. If you take warfarin, discuss your diet with your doctor. Regular blood tests measuring INR, International Normalized Ratio, help your doctor adjust warfarin dosage based on your vitamin K intake and other factors. Never start vitamin K supplements while taking warfarin without your doctor's knowledge and approval. Even small supplements can interfere with anticoagulant effectiveness. Other medications can affect vitamin K status. Antibiotics, especially broad-spectrum types used for more than a few weeks, can destroy intestinal bacteria that produce vitamin K, potentially reducing your body's vitamin K supply. Cholesterol-lowering drugs called bile acid sequestrants, such as cholestyramine and cholestyramine, can reduce vitamin K absorption if taken long-term. Weight loss drug orlistat reduces absorption of fat and fat-soluble vitamins including vitamin K, and people taking orlistat are usually advised to take a multivitamin containing vitamin K. Some seizure medications can interfere with vitamin K metabolism. If you take any of these medications, talk with your doctor about whether you need to monitor vitamin K status or adjust your intake. Don't stop prescribed medications without medical guidance. Here's practical advice for optimizing vitamin K status. Eat leafy green vegetables daily. 1 cup of cooked greens or a large salad provides more than adequate vitamin K1. Include vegetable oils in your diet. Use olive oil or canola oil for cooking and salad dressings. Consider fermented foods if you enjoy them. Sauerkraut, natto, and certain cheeses provide vitamin K2. Include animal products if you eat them. Eggs, meat, and dairy contribute vitamin K2. Remember, vitamin K is fat-soluble, so eating it with some fat improves absorption. Drizzle olive oil on your salad. Add cheese to vegetables. Cook greens with a small amount of oil or butter. This significantly increases the vitamin K your body actually absorbs. Most people don't need vitamin K supplements if they eat a balanced diet with vegetables. Multivitamins typically contain 75 to 120 micrograms of vitamin K. Single nutrient vitamin K supplements are available but unnecessary for most people. The exceptions are people with absorption disorders, those on long-term antibiotics, or people whose doctors have identified deficiency through blood tests. If you're considering vitamin K supplements, consult your doctor first, especially if you take any medications. Your doctor can determine whether supplementation is appropriate for your specific situation. Quick recap. Vitamin K is absolutely essential for blood clotting and bone health, with promising benefits for heart health and possibly other conditions. Adult men need 120 micrograms daily. Adult women 90 micrograms daily. Green leafy vegetables provide abundant vitamin K1. Animal products and fermented foods provide vitamin K2. Deficiency is rare but serious, causing bleeding problems and potentially weakening bones. Natural vitamin K has no known toxicity at high doses. The critical concern is interaction with warfarin and other blood-thinning medications, which requires careful monitoring and consistent intake. Most people easily meet their needs through diet without supplementation. If you take warfarin or other anticoagulants, work closely with your doctor to maintain consistent vitamin K intake. If you have conditions affecting nutrient absorption, discuss vitamin K status with your healthcare team. If you experience unusual bruising or bleeding, see your doctor promptly for evaluation. Never start high-dose supplements without medical supervision. You now understand how vitamin K functions, why your body needs it, how to get adequate amounts, and important safety considerations. This knowledge helps you make informed decisions about your diet and health. If this information helped you, please hit that like button. Helps us reach more people who need this information. Comment below with your thoughts. Are you getting enough vitamin K in your diet? Which vitamin K-rich foods do you eat regularly? Have you experienced any deficiency symptoms? Your comments help others learn. Subscribe and turn on notifications for more evidence-based health information. No hype, just research and practical guidance you can use. Thank you for watching. Make sure you're eating those leafy greens regularly. Stay consistent with your diet, especially if you take blood thinners. See you in the next video. Stay healthy, stay informed, and God bless.